Hi, welcome to Telehealth Video Information Series. I'm Garvin and this video is on DuoTrav Drops. So DuoTrav is indicated in adults for the decrease of intraocular pressure in patients with open-angle glaucoma or ocular hypertension who are insufficiently responsive to topical beta blockers or prostaglandin analogues. So DuoTrav is used, as I said, for open-angle glaucoma and raised pressure in the eye. So how does it work? DuoTrav eye drops contain two active ingredients, travoprost and timolol malate. These are both medicines that lower raised pressure within the eye. They work in different ways to produce a combined effect greater than either medicine produces on its own. The pressure within the eyeball is naturally maintained by a continuous flow of liquid called aqueous humor through the eyeball. Aqueous humor is produced by a part of the eye called the ciliary body. It drains out of the eyeball through channels called the trabecular meshwork. If the outflow of aqueous humor is blocked, the aqueous humor builds up inside the eye, increasing the pressure within the eyeball. The pressure needs to be reduced, as otherwise it can damage the optic nerve and impair vision as a result. Travoprost is a type of medicine called a prostaglandin analogue. It reduces the pressure in the eye by mimicking the action of a naturally occurring prostaglandin. Prostaglandins are a group of natural body chemicals found in many places in the body. In the eye, they increase the drainage of aqueous humor out of the eyeball. Travoprost is a synthetic prostaglandin that acts on the same receptors in the eye as the natural prostaglandins. It therefore causes an increase in drainage of aqueous humor out of the eyeball. This decreases pressure within the eye. Timolol is a type of a medicine called a beta blocker. These medicines block beta receptors in various parts of the body. Blocking the beta receptors in the eye reduces the amount of aqueous humor that is produced. Timolol therefore reduces the inflow of aqueous humor into the eyeball and so decreases the pressure within the eye in a different way. The combination of these two medicines is used to lower the pressure in the eye when one of the medicines does not lower the pressure enough on its own. So how do you use DuoTrav? If you wear contact lenses, you should remove them before putting in these eye drops. You should wait at least 15 minutes after using the drops before putting your contact lenses back in. One drop should be put into the affected eye once a day, at the same time each day. The medicine is most effective if the drops are put in the evening. It is recommended that immediately after administering the eye drops, you press the tear duct at the corner of the eye closest to the nose. So that's just right here. For about 1 minute. This is to minimize the amount of medicine that may be absorbed into the bloodstream and increase the local effect in the eye. When using the eye drops, you should take care to not touch the dropper tip on any surface or to your eye in order to avoid contaminating the eye drops with germs that could cause eye infections. So for use during pregnancy and breastfeeding, this medicine should not be used during pregnancy unless considered essential by a doctor, as it may be absorbed into the bloodstream and could be harmful to the unborn baby. Women who could get pregnant should use an effective method of contraception to avoid getting pregnant while using these drops. So if you get pregnant while using these drops, go and see your doctor for advice. Women who are pregnant or are trying for a baby should also avoid getting the eye drops on the skin, as the medicine can be absorbed through the skin. If you accidentally get a lot in the eye drop solution on your skin, you should wash it off straight away. This medicine may pass into breast milk after being applied to the eye. The manufacturer states that it is not recommended for women who are breastfeeding. So if this relates to you, get advice from your doctor. So the side effects would be red eye due to increased blood supply, eye irritation including stinging and itching, change in colour of the iris, darkening, thickening and lengthening of the eyelashes, eye pain, eye swelling, and dislike of light, inflammation of the lining of the eye, and dry eyes and irritation of the eyelid, and swelling of the area at the back of the eye responsible for seeing fine detail. And the side effects I've just mentioned does not include all the side effects listed by the medicine's manufacturer. For more on any other risks or possible side effects, you need to read the information leaflet that comes with this medicine or speak to your doctor or pharmacist. So how can this medicine affect other medicines? If you're using more than one type of eye drop, you should administer them at least 5 minutes apart to prevent the second drop washing away the first. Use eye gels or ointments last. Eye drops can be absorbed into the bloodstream from the eye, and once in the bloodstream, they have the potential to interact with other medicines. For this reason, you should be aware of the following. In people with diabetes, timolol can prolong the lowering of blood sugar caused by insulin or anti-diabetic medicines. People with diabetes should monitor their blood sugar, as timolol can also mask the signs of hypoglycemia. Timolol may also have an additive effect on medicines that decrease blood pressure, particularly medicines that are used to treat high blood pressure. This may cause dizziness, which can usually be relieved by lying down until the symptoms pass. If you feel dizzy while using this medicine in combination with medicines that can lower blood pressure, you should let your doctor know, as your doses may need adjusting. The timolol in these eye drops may enhance the effects of the following medicines that you take by mouth or orally, which may result in low blood pressure or a slowed heart rate. So, beta blockers, calcium channel blockers such as verapamil, diltiazem, digoxin, and medicines for abnormal heart rhythms such as amiodarone. If the medicine clonidine is suddenly stopped, it can cause an increase in blood pressure. This increase in blood pressure may be worse in people taking beta blockers, including eye drops such as DuoTrav. Beta blockers oppose the action of medicines for asthma that open the airways, which is why these eye drops should not be used by people with asthma or other breathing difficulties. So that brings this telehealth video to an end. If you have any questions, you can leave them in the comments below or contact me through our website, mytelehealth.info, or call into us at Lynch's Pharmacy in Douglas, Cork. Or you can ring us on 021 436 6923 to find out more. Thank you for watching. Stay healthy and stay informed.